So get this, what if I told you there's a single, really simple test that can act like an early warning system for your body's most important filters? Well, today, we're diving into exactly that test. And trust me, getting a handle on what it means could be a total game changer for your long-term health.
And really, it all boils down to this, right? What can one simple test actually tell you about your kidney health? The answer, believe it or not, is hidden in a totally routine urine sample. And it reveals a ton about how well your kidneys are doing their job of protecting you.
Okay, so before we jump into the test, let's talk about the real stars of the show here, your kidneys. Seriously, think of them like your body's master filter. They are working 24/7, tirelessly, to do one crucial thing: keep all the good stuff in and get all the bad stuff out.
Now, to really get what's going on, you just need to know about two key players, albumin and creatinine. Think of albumin as the good guy. It's this super important protein your body absolutely needs. Healthy kidneys are like a bodyguard, making sure it stays in your blood. Then you've got creatinine. That's the waste product that your body needs to get rid of. So healthy kidneys act like a filter, pushing it out into your urine. The whole story, the entire point of this test, comes down to that super simple balance. Keep the good protein and get rid of the waste. That's it.
So, with that in mind, we can finally talk about the test itself. It's really just a way of checking in on those kidney filters to see how well they're handling these two specific things.
All right, so the official name is the urine albumin-creatinine ratio, which is a mouthful, so everyone just calls it the UACR test. It's a simple urine test, and what it does is measure the amount of both that good protein, albumin, and that waste product, creatinine. The ratio between those two numbers gives your doctor a really clear snapshot of how your kidneys are doing. Because, if that good stuff, the albumin, is starting to leak out, that can be one of the very first signs that something's up.
So, you might be wondering, when would my doctor even order this? Well, it's super important for conditions that put a lot of extra strain on the kidneys. We're talking about things like diabetes or high blood pressure. It's also a pretty standard check if you already have known kidney or heart problems, or even if you have certain risk factors, like being over 50 or having a BMI over 30.
And here's the best part. The test itself is incredibly simple. Seriously. Let's just walk through it real quick so you know exactly what to expect.
Okay, getting ready for it is a piece of cake. Your doctor will probably tell you to make sure you drink enough fluid so you can, actually provide a sample. But they'll also ask you to skip any super intense exercise or even eating meat for about 24 hours before the test. Why? Because both of those can temporarily throw off the results. Oh, and it's also really important to give your provider a heads up if you have any kind of infection or bleeding, since that can mess with the sample too.
All right, the collection part. They use something called the clean catch method, which sounds technical, but it's just to make sure the sample is as pure as possible. It's simple. First, you wash your hands. Then, you'll start going to the bathroom in the toilet, then you pause midstream, collect the sample in the cup, and then just finish up in the toilet. That's it. It's totally painless, non-invasive, nothing to worry about at all.
Okay, you've done the prep, you've done the test, and now for the main event. What do those numbers actually mean? Let's decode these results together.
Before we get into the nitty-gritty, just remember this one simple rule. With the UACR test, a lower number is always better. A low number basically means your kidneys are doing an awesome job holding on to that valuable albumin protein, keeping it right where it belongs, in your blood.
So your result is going to be a ratio, measured in milligrams per gram. And it basically falls into one of three buckets. First, anything under 30. That's considered normal, very low risk. Great news. Then there's the middle range, 30 to 299. This means there's some albumin present, which signals an increased risk. And finally, if the number is 300 or higher, that suggests a lot of albumin is leaking out, putting you in a high-risk category for kidney disease. So, if your number comes back under 30, you can breathe a sigh of relief. That is fantastic news. It means your risk for any serious issues is super low. Your doctor will probably just want to do another test in a few months just to make sure everything's staying stable. Okay, what if your number falls in that middle range, between 30 and 299? First things first, don't panic. This isn't a disaster. Think of it as an early warning flare. It might mean you're in the beginning stages of kidney disease, but the key word there is early. It gives you and your doctor a fantastic opportunity to step in and take action to protect your kidneys before things get worse.
Now, a result of 300 or more,
That's a more serious signal. We got to be straight about that. This indicates that a pretty significant amount of that good protein is being lost, and it points toward more moderate or even severe kidney disease. This is the point where your doctor is absolutely going to want to run some more tests to get the full picture and start putting together a solid treatment plan.
So look, no matter where your results fall, normal, in the middle, or high, knowledge is power, right? So let's talk about what comes next and what you should be keeping an eye on. Obviously, if you're at risk, your doctor's going to guide you. But you can also be your own best advocate by being proactive and just watching for a few key symptoms. We're talking about stuff like changes in how often you have to go to the bathroom, or if it looks foamy or bloody, or maybe you've got really dry, itchy skin that won't go away. Even things like feeling tired all the time, or swelling in your hands, feet, or ankles, those are all signs you should definitely report to your provider right away.
You know, there's this quote that really just says it all. The earlier a provider detects kidney disease, the easier it is for them to delay or even prevent kidney failure. And that right there is exactly why this test is so incredibly important. Catching things early makes all the difference. So at the end of the day, the UACR test isn't really just about a number on a lab report. It's about giving you knowledge. It's about giving you time. Time to take action and empower yourself to protect your health for years and years to come.